Today's episode is about the most effective treatment for back pain. Back pain is a common problem that can be caused by a variety of factors, such as poor posture, injury, or underlying medical conditions. Treatment options for back pain can range from self-care measures to more invasive procedures. Here are some scientifically proven facts about the most effective treatments for back pain. Exercise is a recommended treatment for back pain. A systematic review of randomized controlled trials found that exercise can improve function and reduce pain in people with chronic low back pain. Another study found that a supervised exercise program was more effective than usual care in reducing disability and pain in patients with subacute or chronic low back pain. Manual therapy, such as spinal manipulation or massage, can be effective in reducing back pain. A systematic review found that spinal manipulation was associated with a small but statistically significant reduction in pain and improvement in function in patients with acute low back pain. Another study found that massage therapy was associated with significant improvements in pain, function, and quality of life in patients with chronic low back pain. Medications can be used to manage back pain, but they are not generally recommended as a first-line treatment due to potential side effects. Non-steroidal anti-inflammatory drugs are commonly used for pain and inflammation relief. A systematic review found that these drugs were effective in relieving pain and improving function in patients with acute low back pain. Another study found that muscle relaxants were effective in reducing pain and disability in patients with acute low back pain. Other studies found that cognitive behavioral therapy and acupuncture can also be effective in relieving back pain. It is important to note that the effectiveness of these treatments may vary depending on the individual and the cause of the back pain. It is recommended to consult a spine specialist to determine the best treatment approach for each individual patient. If you need a consultation about your condition, please visit our website.